Hello, I'm Dr. Dori Carlson, the President of the American Optometric Association. This is the time of year when we hear State of the Union or State of the State addresses. So in that vein, I'd like to give you all a brief State of the Profession address. In other words, how are we doing as an association and as a profession? I'm proud to answer that the state of the AOA and the state of the profession, thanks to the AOA, is sound. In 2011 and already in 2012, the AOA has continued to score victories for optometry in Washington and has continued to assist affiliates in their state legislative and regulatory battles. We've continued to build on our earlier victories on Capitol Hill. You may recall that as the Affordable Care Act began its long and convoluted trip through Congress, the AOA stayed focused not on the pros and cons of the bill itself, but on the opportunity health care reform provided our patients to improve access to optometrists. And so we advocated strongly for children's eye and vision benefit to be part of the essential benefit for the insurance plans in the exchange, and we won. Following that win, organized medicine declared war on the children's benefit and tried to reduce it to a simple vision screening at the pediatrician's office instead of a comprehensive eye examination by an eye doctor. They pulled out all the stops, but so did the AOA. The AOA lobbied hard to ensure that kids could truly get the care they needed, and in December, a CMS ruling referenced benefit plans that included comprehensive eye exams as the model for the exchanges. Screenings weren't even mentioned. Now, as in much of the ACA, the battle moves to the states for implementation of those recommendations, and the AOA will continue to support the efforts of our affiliates on this important issue. This week, I'm hearing that many of our members are now receiving generous payments from CMS for implementing EHR in their practices, thanks to our earlier victory in changing language in the American Recovery and Reinvestment Act of 2009. The original language specifically excluded optometrists from being eligible to receive this important payment, that is, until the AOA stepped in. That one payment will cover the average member's dues for 22 and a half years. How's that for a return on your investment? AOA continues to fight for our reimbursements with Medicare. In fact, in spite of all the ups and downs at Medicare and the political wrangling, the codes used most by optometrists have actually seen a slight increase in reimbursement, while the vast majority of other providers have had to deal with substantial decreases in reimbursement. This year, optometrists will receive over $1 billion in Medicare reimbursements. That works out to be several $1,000s per member, another very tangible return on your investment in AOA. Together, states and the AOA have defended optometry payments and procedures covered in over a dozen states regarding TRICARE, as well as other third-party payers. Our third-party care committee continues to press forward to make the case for optometry's role in value-based healthcare and a patient access to optometry. Today, the United Auto Workers now integrate optometrists into the medical plans for eye and vision care in parity with medicine. Additionally, historic scope of practice battles are being won all over the country. Our PAC raised over $2 million in the last election cycle. That's a record, and we're now one of the largest healthcare PACs in the country. Our optometry public affairs campaign is now in its 7th year, and thanks to the AOA and your support of the AOA, we are now positioned as the go-to organization when the media needs information about eyes, eye care, and vision. The public's now getting to know us as a critically important component to their healthcare. Just this month, I was quoted in Family Circle magazine. Financially, we continue to be strong because of your commitment to the AOA and the AOA board's resolve to control costs and redirect resources to advocacy efforts both federally and statewide. Our budget has seen modest growth over the last few years, and the demands on those resources are shifting all the time. Your AOA board is committed to a nimble financial strategy to allocate resources where and when they need to be allocated. We also are committed to rebuilding our reserves, which have taken a hit after the 2008 market crash and the simultaneous funding of the defined benefit retirement plan. Nevertheless, the budget we are presenting to the House of Delegates in June will seek a $1 million addition to our reserves. This demands both fiscal responsibility and fiscal agility, and it can and will be done. Our membership and market share remains much higher than most healthcare associations. The good news about membership is that we have roughly the same number of members today as we had in 2008. The bad news about membership is we have roughly the same number of members today as we had in 2008. As we've drilled down on the membership issue, it's clear that our new graduates are not converting their membership from student status to active status at the rates that we have historically enjoyed. Our members on the back nine of their careers are beginning to retire and semi-retire faster than the new grads are joining. This must be and will be addressed. And I've already begun that effort by visiting every school and college of optometry personally over the past 20 months, taking our message directly to the students across the country. We've enjoyed great successes in these last few years, yet much remains to be accomplished. We will have to again do our best to predict the future and proactively engage that future while defending the gains already achieved. 1. Medicine has already declared war on the Harkin Amendment, which would clearly diminish patients' access to their optometrist. 2. States are seeing record numbers of anti-patient and anti-access bills introduced into their legislators. 3. A change in the administration or control of either or both houses of Congress will reshuffle the deck on healthcare reform, and we must be prepared for that. Attacks from outside our profession have been vigorous, but so have attacks from within the profession. The factually bankrupt foes of the AOA have turned up the volume of their deliberate misrepresentations designed to confuse and destroy. If you have a question about your AOA, don't hesitate to contact me or any other board member. Our books have always been open to you. Annually, we publish audited financial statements to ensure transparency and integrity. You deserve an open and honest and responsible AOA. Intentionally misleading attacks that serve to give aid and comfort to optometry's enemies simply can no longer be ignored. We defend our association and its mission not for the sake of the association, but for the sake of optometry, our members, and most importantly, the patients we serve. The AOA is committed to moving optometry forward in this new age of healthcare. Some have attacked us for bold moves at a time when bold moves are essential to our profession's survival. The world's moving very fast, sometimes faster than you and I would want. But the status quo just won't cut it in the months and the years ahead. The changes ahead are sometimes daunting, and as with all change in life, it comes with both risk and great opportunity. The AOA is the only organization with the will, the means, and the manpower to minimize that risk and capitalize on the opportunity for our members and the patients we serve. We put the boots on the ground for our profession every day. As a member of this great organization, you've already joined me in that effort. Thank you. I ask you to continue to be an advocate for our profession and our patients. If you know optometrists who are not members, invite them back into the family to join us. I and the AOA board cannot do this job alone. We need each and every optometrist, private practice, employed, academic, or federal. We need all of you. Thank you for what each and every one of you do every day to enhance our profession and move us forward. When we move together, we move mountains. We always have, and we always will. Thank you.